Thank you and good afternoon. So today we are reporting on 4 periods over the since last Friday. So that's Friday to Saturday, and we had 43 new cases. From Saturday to Sunday, there were 29 new cases. Sunday to Monday, 46 cases. And Monday to today, another 28 cases who tested positive or were epidemiologically linked. So that leaves us 146 new cases since Friday, 4 of whom were epi-linked, the rest who tested positive for COVID-19, bringing our total in British Columbia to 3,787 cases. That includes 1,119 people in Vancouver Coastal Health, 1,989 in the Fraser Health region, 146 people on Vancouver Island Health, 377 people in Interior Health, 91 people in the Northern Health region, and 65 people who reside outside of Canada. We currently have 319 active cases in the province in all health authorities, of whom 8 are hospitalized, 4 of whom are in critical care ICU. In the last 4 days since Friday, we have had no new deaths from COVID-19. Our total remains at 195 people who have died from COVID-19 in BC. Additionally, there are 3,273 people who have now recovered from COVID. We have 1 new healthcare outbreak in the Fraser Valley region at the Maple Ridge Seniors Village Assisted Living Facility, where there's a single staff case at the moment, but Fraser Health is on site and the outbreak protocols are being implemented. The outbreak at Mission Memorial Hospital has now been declared over. So we now have 3 active outbreaks in our healthcare system, all of them right now in long-term care or assisted living. And that includes 660 cases, 404 residents, and 262 staff. We continue to have active outbreaks in a number of exposure events in the community, but particularly at the Fraser Valley Packers, that is now up to 74 cases that are linked to that exposure event. Before I get into the rest of my remarks today, I would like to take a moment to recognize a very special colleague and friend for a very special achievement. Yesterday, our Lieutenant Governor, Janet Austin, announced this year's recipients of the Order of BC, and I am absolutely thrilled that my colleague and friend and mentor, Dr. Mel Krajden, was one of the 13 well-deserving recipients. Dr. Krajden, you've heard us talk about him many times, has been on the front lines of our COVID-19 response and has been on the front lines of a number of public health responses over his many storied career. He was instrumental in developing one of the first tests for COVID-19 in the country and continues to work tirelessly on behalf of all of us in BC. And congratulations, Mel, from all of us. We're so proud of you. So as you can tell, there have been a number of new cases over the long weekend. This was not unexpected. We knew that events that had happened in the previous couple of weeks would lead to more people who had been exposed developing illness. We are now seeing people who were exposed up to 2 weeks ago. This is a concern because the majority are related to what happened prior to this long weekend. The source of these cases is varied, and as we've talked about many times, this is something that we take very seriously in public health, and to track down and trace how every single case became infected is important to us. Many continue to be related to private gatherings or small parties that happened over the last month. Many are with travel within BC and Canada, and some are people who have traveled here from outside of Canada. We also have had a number of exposures in workplaces where people have passed it amongst work colleagues. In all of these cases, the common factors are really the same. It's about the things that we're doing when we're in close contact with people, and that includes talking, laughing, joking around, sharing drinks, sharing food. Crowds, so larger combinations of people where we were having those close interactions with many people over a period of time. Often indoors, and the indoor settings we know are areas that are more at risk for us to be transmitting this virus to others. We need to make sure these cases don't result in a dramatic uptick once again. So anybody who has been exposed over this past few weeks now knows, and many of you are in isolation right now and need to be monitoring carefully for symptoms. It is always a concern for me and everyone in public health when COVID-19 spreads unchecked and the source of the transmission is unknown. Thankfully, most of our cases, the vast majority of them, we are able to find out where you've been exposed. And we know that many of those are overlapping social circles where private parties over the period of the last few weeks have led to people passing it to their friends and their family. In the immediate days following a long weekend are when people can also unknowingly spread the virus to others. So for the next coming days, we need to remember what it was that we were doing over these last few days. And the next 2 weeks is important for all of us. Coming out of this BC day-long weekend, we all need to pay attention to how we are feeling. We cannot go to work if we're not feeling well. Contact 811 should you develop any symptoms. We also need to pay attention to where these exposure events have been made. And if need be, we need to immediately limit our time with others. If we were at one of the events where an exposure happened, where somebody was identified with COVID-19, and you may know that in the next couple of days, you need to limit your time with others and take precaution to protect your family, your friends, our communities. The alerts, as we know, are posted on the BC CDC website and on all of the health authority websites. These provide details on where potential exposure occurred and what actions you need to take. Public Health will be contacting people directly for those who we know were at events, but sometimes we don't have that information. And that means it's important that you are all aware of where you were and who you may have been in contact with. And that information you will be provided is whether you need to immediately self-isolate for the period of time after the exposure event, or simply to monitor for symptoms if it was a less risky exposure. When there has been an exposure in a workplace, many businesses are also notifying their customers and in many cases temporarily closing to make sure that they have additional cleaning. And we encourage businesses to keep doing this. This is a way to build confidence in all of us that we know where COVID is and we know what to do and how to manage it. When public health teams or a business issues an alert, it shows us that our monitoring and our public health response is working because we have identified the source of transmission and know who may be exposed. We know and we have learned that this virus can and has appeared in communities in settings across BC, from private parties to workplaces to healthcare, long-term care, and travel. It doesn't discriminate, and nor can we. We must all be alert. We must all be ready to be tested if we need to, and to stay home and away from others if we're ill. We know that COVID-19 is going to be in our communities for some time to come, and we need to continue to do what we know will help to minimize the cases that we have and manage those when they arrive. While it remains in BC, we need to keep it low and slow. When we spend time with friends, when we visit another community on our summer holidays, or take a flight to see our family, the actions we take make a difference to our COVID-19 pandemic curve. We all know what we need to do to keep each other safe and healthy. So let's make sure each day for the rest of this summer, we all play safe and stay safe, and continue to take those necessary precautions that we know will protect everyone in BC. And let's also continue to be kind and to be calm and to be safe.